Hi, thanks for joining Children's Wisconsin for our live broadcast today. For those of you joining us for the first time, I'm Dustin and I'm a member of the Children's Wisconsin communications team. Over the past few weeks, we've been scheduling live Q&A sessions like this one with some of our providers focusing on the ways that we're continuing to support and provide the best and safest care to kids during the COVID-19 pandemic. Today, we're taking some time to talk about the idea of social distancing. While Wisconsin's safer at home order has expired, experts across the board are still advocating the idea of social distancing as a way to combat COVID-19 and decrease its spread. For many of us, the idea of social distancing is only a few months old. When the pandemic began, the term entered our cultural lexicon and took hold. However, for some families, social distancing has been a necessary part of their life for much longer than just these few months. Individuals who are immunocompromised have had to adapt to lives with necessary social distancing measures for their health and safety, and they can teach the rest of us a lot about ways to not only survive in a time with a need for social distancing, but how to thrive with it as well. Today, I'm really excited to be joined by three guests. We have Dr. Kerri Becktell, Ian Korthals, and his mom, Melissa. Ian has been immunocompromised for roughly a year and a half, and Dr. Becktell has been one of his doctors for roughly a year. Dr. Becktell, I'll start with you. Can you tell me a little bit about what you do here at Children's?
Sure. And I just want to say thanks again for having us be a part of this. So I'm one of the members of the oncology team here at Children's, which means I take care of children and teenagers who are diagnosed with many different types of cancers. And so in my role as a member of the solid tumor oncology team, I've been taking care of Ian for about a year since I started here as faculty last summer.
Okay. Can you explain a little bit to us about what it means for someone to be immunocompromised?
Sure. So when we use the word immunocompromised, what we mean is that the normal immune system, so the groups of cells that work to fight infections in your body, aren't working as they should. And for many different types of childhood diseases, cancer in particular, we use a lot of treatments that have side effects that impact the immune system. And so the medicines we need to give to cure cancer make your immune cells not work as they should. And so when someone is immunocompromised from medications or transplants or even radiation, what that means is that their body doesn't have the ability to fight off infections like other people's would. And so they're at risk of contracting more infections. And when they get an infection, they're at a much higher risk of getting more severely ill from those infections.
Okay. Ian and Melissa, first off, thank you so much for taking some time to be with us today. I'm hoping that you can tell us a little bit about Ian's diagnosis and how long he's been immunocompromised for.
Yes, Ian has a high-risk neuroblastoma, and he was diagnosed January of last year, around January 10th. And he started chemotherapy just a few days after he was diagnosed. So he's been immunocompromised in one way or another for the last year and a half.
Okay. I imagine that a diagnosis like this means your family has needed to make some adjustments to your lives, many of which, like social distancing, are things that are now being recommended in response to COVID-19 for all of us. What are some of the things you've had to do to keep Ian healthy even before COVID-19?
Pretty much the same things. We limited contact with friends, family, always watched for anyone sick, any sign of sniffles, cough. Ian's always wore a mask in public, lots of hand washing, hand sanitizer, cleaning up around the house, and just kind of keeping to ourselves is pretty much what we've been doing. So,
okay. I've read in a few places that a more apt description instead of social distancing would be physical distancing. The idea being that we can still be social and connected while we're not physically near. Ian, I was hoping you could tell us a bit about how you've connected with others outside your immediate family while still staying physically distanced.
It's helped a lot for like FaceTiming or Snapchatting or Skyping, whatever you can do. and playing games or talking or stuff like that. And just also with your family, make sure that you spend time with them to stay occupied with your time.
Okay. Melissa, as a parent, I can imagine sometimes it's difficult, to put it lightly, to know if you're making the right decision when making any choice for your health, your child's health. Do you have any advice for parents and families who are working to adhere to social distancing and other health and safety guidelines that are new to them?
Yeah, I guess the right thing to do for your family and how comfortable you feel. We've kind of, I don't know if I could have stepped up what we've done, but we still make sure, very limited visitors now. Just rules you think will work to help your family stay safe. Yeah, I'm not sure what else,
Okay.
I've always talked with my kids, I've been upfront with them, I've told them the dangers, not scaring them, but I've always been able to talk to both my son and daughter about, how to stay safe and the virus and how it works, and, so that they're not scared of it, but, know that they need to be careful with what they do.
Mm-hmm. Ian, do you have any advice for kids like your age who are trying to adjust to social distancing and are struggling with not being able to hang out with their friends like they're used to?
Like I said before, I guess FaceTime, do stuff like that, and maybe to keep your time or do stuff with your time, try to do a hobby that you can do, like that obviously is social distancing stuff. So it's might be hard for a bit, but once you're used to it, you should be good.
What are some of your favorite hobbies that you do?
Definitely video games, hanging out with my family, like watching movies, playing board games. Obviously not right now, but like I did gymnastics, so I can do gymnastic stuff at home. Like not now, obviously, but if you do like soccer, play soccer with your family or football or something like that.
Yeah.
And just talk to your friends over FaceTime while you're doing that. To be more fun, or set challenges for yourself every day or something.
Yeah, that sounds like a good way to stay engaged and utilize those around you continuously as well. Do you guys have, both of you, kind of some general suggestions for families as we get into summertime, as things that they can do to stay active but stay safe as well?
Be creative. I've come up with lots of ideas around the home to do. Now being outside will be a little easier. I guess just make your house your vacation area. We've got games, yard games. There's a trampoline. He doesn't do a lot of that with his lines, but we have a nice backyard, so we take advantage of just hanging out and doing things outside, because we've been in winter. Winter was very long, so.
Yeah, I think all of us in Wisconsin are familiar with that, and especially as we get to the summer months, I think it's important to take advantage of being able to go outside and be able, the fact that we're able to do that safely.
Yep.
Dr. Becktell, from a doctor's perspective, what kind of advice do you give families who have a child that is immunocompromised that you think would translate well to families that are dealing with COVID-19?
Yeah, Melissa hit on a lot of these, which means we're doing a good job of communicating to our families, but we really talk a lot about just being very aware of your environment and the people around you. So don't put yourself in a situation where you're going to be in big groups if you can help it. If you're going to have visitors, make sure that you know if they've been sick at all. And I think learning how to ask people if they've been sick, definition of being very ill or having a little cough and cold. A little cough and cold can be very dangerous to someone with a compromised immune system. And so just limiting people and still seeing your family and seeing some friends when you're healthy and able, I think is really important for your emotional health. But it's all about just knowing, making calculated plans and having a plan for planning ahead and making sure you're washing your hands, using hand sanitizer. We always encourage our families to call us if there's something that, that a patient wants to do and the parents aren't sure, our always big advice is trust your gut. You're the parent, you know, as Melissa said, but we're also always willing to talk through scenarios. And my hope is that, you know, as families are dealing with this for the first time, that pediatricians' offices are still open to some capacity and also would be willing to talk through some of these things, because I think parents know best, but getting a little reassurance from your medical team is always helpful.
Yeah, and certainly here at Children's, all of our pediatric offices are open and available for consults, and everybody that has a children's doctor should feel comfortable reaching out to them via phone or MyChart. In regards to the idea of social distancing in particular, why is this such an important action right now as it relates to COVID-19?
So there's lots of challenges we're facing with COVID-19, but one of the biggest ones is the lack of a vaccine or lack of effective treatment that we know of. And so our best hope is to slow the spread of this and to keep as many of our pediatric patients out of exposure range of this. And so what we've learned from watching this happen sort of around the world is that social distancing and staying 6 feet away from each other is really the best way to help slow the spread. And it's particularly important because we know that people, adults and children, can have the virus without having symptoms, to be really conscious of social distancing at all times and not just when people are ill, which is a little bit of a different scenario than we have often faced, but it's our best bet at keeping this under control and slowing the spread.
Okay. I want to transition just a little bit here, as we've been talking about how much there is to learn from individuals who are immunocompromised, about the lifestyle side of things and staying active. What about the clinical side of things? I imagine that there's a lot about how we keep immunocompromised patients safe that translates into our response for COVID-19. Can you talk a little bit about that?
Yeah, absolutely. I think that Children's has had a huge team that has really formed the response to COVID-19 and how we approach things here in the hospital. And a lot of the fundamentals that we started with when the pandemic really hit was thinking about how we appropriately use protective equipment like masks and gowns, and isolating patients when they needed to be isolated. Again, we have very clear hand washing and hand sanitizing guidelines that we enforce on our unit pretty religiously. And so a lot of that fed into then what we translated for sort of trying to prevent and contain the spread of COVID within the hospital. And the other part of the response that Children's has really embraced is trying to limit the exposure to other patients and families when children do need to come. We don't function in a way that our patients can just stay home for 6 months. And so the hospital has really been thoughtful about limiting visitors and spacing out appointment times so that waiting rooms aren't filled, so you can't be distant from, strangers essentially. And so as the situation has evolved, the response here at Children's has continued to evolve. And it's a lot of changes, but I think that speaks to trying to stay on top of things. And when new information is available, there's new policies or change in policies in place so that we can make the hospital and the clinic as safe as it can be, knowing that our patients need to come to continue to get care here to make it as safe as we can.
Okay, thank you so much, Dr. Becktell. Before we get to any questions that were submitted, are there any final things that you would like to say, Melissa and Ian?
I just guess stay positive. It can be draining to be confined and, not being able to do your same activities. But we find if you have a positive attitude, there's always something positive to find, and that helps you get through, I think, some of the worst things you have to deal with. So.
Okay. Ian, anything from you?
Yeah, just like my mom said, just stay positive. Don't let yourself get down. If you do, try to find the bright side of this. Like for me, COVID really hasn't changed my life at all. And it made my friends be at home more throughout the day. So for me, it's actually more positive
Uh-huh.
because I get to hang out with them more than if this wasn't happening.
Yeah.
So like it's not fun to stay inside, but then again, I haven't really been able to do much outside. Sure, we could go to places, just be careful with the mask, but
Mhm.
now it's nothing. But
Okay. Dr. Becktell, how about you?
I was gonna say, Ian, last time I saw you in clinic too, I think that I don't know if you appreciate how much you're able to help your friends get through this because you're so good at staying positive. And so I think we all have to try to embrace that. I think, here at Children's, we want to make sure we still are able to provide safe care, and we want people to stay positive. We want people to know that they can come here safely if they need to, and that while this may last quite a long time, Ian is proof that you can do this for a long time and still have a really good attitude. So my hope is that people can take that away from this discussion.
Did we get any questions?
No questions, but a lot of Ian fans who want to say hello.
Okay, well, I actually have a question. Ian, you said one of your favorite hobbies is playing video games. So I'm curious what your favorite video game is right now.
that's hard because I like video games so much.
Okay.
As of right now, in this situation, my favorite games are like multiplayer games that I can play with my family. But it's always been Mario that I've enjoyed the most.
Okay.
Because when I was young, I played Mario because Mario. It's for my age. So it appealed to me like that. But I do play Minecraft with my friends, and I sometimes play Fortnite.
Okay.
I don't really like shooting games that much, but Fortnite's an exception because it's cartoony and there's nothing but just, it's funny sometimes.
Yeah, those are fun. Those are good ones to play with your friends for sure. Well, again, thank you all so much. We really appreciate you guys taking the time today to talk with us and our audience. For those of you still watching, as always, if you have any questions about Children's Wisconsin or COVID-19 in particular, we encourage you to visit our website, childrenswi.org. There you can find all kinds of resources, from details about our locations and hours to blogs about how to talk to your kids about COVID-19, and information about the safety measures that we are taking across all of our locations to ensure you and your child's best and healthiest experience. If your child needs medical attention, we are here with our telehealth options, including Children's Online Urgent Care. There are numerous ways to get your child the help they may need. At all of our locations, we're taking all of the necessary precautions to keep you and your child safe and well as we make it through COVID-19 together. Thank you again so much for watching. And Ian, Melissa, and Dr. Becktell, thank you so much for joining me.
Of course. Thank you for having us.
Yep. Thank you guys.
Mm-hmm.